Okay, I think we are live now. Let's give our viewers a couple more minutes to, or not minutes, seconds to join. Nice to be on a virtual session with you, Teppo.
Thanks, Mikko. Nice to be here with you and also with others.
Yep. We were first planning on doing this live, but due to some geographical limitations, we decided that it's better to do it remotely. But I'm sure that that won't affect the content by any means. Okay, I think we can go ahead and get started. People can join in later if it's meant to be. And welcome everybody to the webinar. Today we will be discussing about modern asset management in healthcare, and specifically how to move from Excels to software in this setting. And today the speakers will be myself and then Teppo Rajala, who is representing Silmäasema. Teppo, you can go ahead and introduce yourself first.
Thanks, Mikko. I'm working as system specialist in Silmäasema, and I've worked over 10 years closely with medical devices, and nowadays my role is here related to managing medical devices in different kind of aspects, and one thing is that I'm main user with medical device register in our company IDR.
Okay, yes, thank you very much. My name is Mikko Lehmus. I'm the CEO of IDR. We are asset management software designed to manage the life cycles of medical devices. And let's move forward to the agenda. We are trying to keep this in around 30 minutes today. If you have any questions during the presentation, you can go ahead and put those in the chat. We'll answer if we have time in the end, or then we'll send you answers afterwards. And today's agenda, we'll first talk about Silmäasema, the company that Teppo is representing. Then we'll look at some quality aspects and legislation around medical devices. Then we will move our focus towards the asset management for medical devices, and then talk about Excel versus dedicated software for managing medical devices. And then finally, we'll share some best practices and tips that Teppo has gathered in the implementation phase of our solution. Okay, let's start then. And first, a couple words about Silmäasema. Teppo, you can take the lead from here.
Okay, well, Silmäasema is the largest optician chain by turnover in Finland. And in addition, Silmäasema also operates eye hospitals. And we, together with eye hospitals, we have over 150 locations nationwide. And we are part of Coronaria Group, which is one of the most significant healthcare providers in Finland. So yeah, also other aspects, but here we talk about eyes in Silmäasema.
Yes. And yeah, that's a very interesting, and it's a pretty large group, Coronaria Group. So lots of employees, a big footprint, and we are actually using our system in various parts of Coronaria, so not just Silmäasema. Yes. But today we'll focus on Silmäasema because the asset volume and footprint in terms of location and users is the largest. So that's why we are focused on Silmäasema today. And I believe on the next slide, yes, we have some figures for the volume. So altogether, you have almost 5,000 medical devices spread across your locations. And there's some distribution graphs here. Maybe do you want to give some highlights out of these?
Well, both in optical stores and eye hospitals, we have reception rooms. So most of our devices actually are in those rooms, but also we have operational rooms and also equipment maintenance devices in hospitals. But over half of our devices are in reception rooms. And we have there is also other graph there too. Almost 2/3 of our devices are in optical chain stores, and 1/3 is in eye hospitals, and small part are in eye hospitals that are related to public health services.
Okay. Yeah, cool. Yeah, that's a pretty interesting interesting graph right there, the distribution into categories. And it says you have measurement devices, that's like 1/4 of the pool, and then the rest is, I mean, the reception rooms, measurement devices, that's like 2/3, and then the remaining third is all kinds of different kinds of devices like imaging, operating room, laser, and assistive devices. So
yeah, especially kind of hospital medical devices, if you say kind of generally those smaller amounts, but some of them are quite expensive. But anyway.
Yeah, expensive and important in terms of
definitely
taking a good care of the patients, obviously. Okay.
Yeah, have to have trainings and etc.
Yes. Very nice. Very nice. Okay, let's move forward to the quality. Now that we know about your company and what you're doing, quality is a big part of your strategy. Obviously, you have certificates, and maybe do you want? I know you're dealing mostly with the medical devices, managing those and their life cycles, but you are also working with some aspects of quality. So, do you want to raise some highlights from this slide?
Yes, as Mikko said, quality is really important part of our company, and as we can see, we have in hospitals we have ISO 9001 2015 certificate, and in optical side we use harmonized ISO 13485 standard for the product quality control. But in terms of medical devices, are what sites are linked. Medical device play important support process role in our company, and thus it is also medical device parties regularly audited by internal and external audits in eye hospitals especially. And
so kind of moving from Excel to our system is part of quality improvement as well, because you're auditing those internally and externally. And that's I think actually on the next slide we have some more, just for background, so that everybody understands that in Europe the medical device regulation governs the production and distribution of medical devices, and then once a medical device is taken into use, it's the responsibility of the healthcare organization to ensure the appropriate use and maintenance of each medical device according to the manufacturer guidelines. And this is something that the law requires. These are audited, and Teppo, I believe that your company, obviously you have the ISO and other certificates. You're internally and externally auditing your quality aspects, and one part is the medical devices. And you've been audited by the government couple times actually, and you got some feedback for improvements at the time that you were using Excel. So do you want to share some information around that?
Yeah, we got audited by government officials, and we got some improvement suggestions after the first audition, especially related to having a solid service history available in medical device register, and also having trainings history or logs somehow related to the devices. And those were a little bit difficult to keep up to date or in Excel's.
Yeah, and this is kind of one of the reasons, at least, that you decided to look for a software, because I mean, it was first of all difficult to maintain, and then it didn't meet the legislation either. So it's definitely you kind of made a strategic decision that you need to improve on this matter, and then you decided to implement our software for this use.
Yes.
Okay, good. So let's move forward to the actual, this is very interesting data that you've gathered. So main user concerns with Excel. We covered some of this already, but maybe Teppo, we can go through what you have on this slide.
Yes. As I already mentioned, I'm working as a main user with IDR, but I also worked main user with Excel, if you could say so. So we have this device Excel previously, and especially keeping service reports linked to the devices after, for example, device transfers were quite challenging. And having solid service history also was a little bit difficult to maintain. We usually had the latest service marked, but the previous ones were okay. They were in service reports, but not visible in Excel. Or if we wanted to have that, we would have even more heavy Excel as we already had. We had quite many columns already, and every new metadata or element meant new column and more heavier Excel. So that was a little bit challenging at times. Also, risk of losing essential data was really what we had, and we had some user plugins with Excel, but still we had someone managed to delete the whole Excel a couple of times. Of course, we had backups, but anyway, and also someone managed to change device information accidentally. Of course, no one does it purposely, but Excel has had its own challenges in terms of many users.
Yeah, that's definitely true. So when you have multiple people updating it, it's the formatting, what you input in what field, in what format, and then you can delete cells, delete information, put it in wrong cell. So it's very tricky with lots of users and with a large Excel. And I mean, you have 5,000 devices, and this is just Silmäasema. You have the other business unit as well. So it's a large pool of assets and Excel rows, so very difficult. And there's no, obviously, automation. So when you perform the mandatory services, it's manual work to check those and make sure that it's getting done. So very, difficult to optimize things with Excel. Okay, great. So those are the main points from the Excel experiences. Then we have another slide right here where you've gathered the user experience from our system compared to the Excel. Maybe you can go ahead and go through these as well.
Yeah, previously I said about something about our challenges with Excel, and of course with those challenges we got some improvements when we introduced IDR to our company, took it in use. But just to go through the points, well, keeping the information or service history and etc. up to date was easier even after device transfers, after we started to use IDR. Also, it's easy to add metadata such as additional devices, trained personnel. Additional devices combined to this main device, for example. It can be done in IDR, having solid service history, easily available and easy to keep up to date, and readily available statistics also for process evaluation, including personal trainings, data, etc. Related to internal and external audits, we have some data we check on regular basis from IDR, so that the data can be easily exported.
Yeah, for sure. And one thing that I know happened is that before you only had a limited number of people updating the Excel, obviously, because it's yes, very difficult. But with our system, you were able to kind of empower more people into making sure that everything is up to date and maintained properly. So I believe, am I correct that prior you had maybe like 20 users and now you had almost 200 users?
Yeah, something like that. Previously, we had only users from eye hospitals, kind of clinic representatives only, but now we were able to take or add also store managers and assistant store managers from optical chain side to device register user pool. So then we can also, it's not only me managing optical chain side device things, but also store managers are now doing that. So it's good to have people. It's now because we have more users. It's not very big work for one person to update something.
Yeah, exactly. So you have more people responsible for keeping track of a smaller part of the devices, which is easier task. And then because you have the software, it's as automated as possible. And you also utilize the IDR NFC tags so that you can actually get the device information on the field, inventory them, send maintenance requests and so on the spot. So it helps find the information, so you don't need to manually go and look for everything.
And one thing also Mikko already said about those service reminders that we were not able to have in during Excel time, but now those are very happily welcomed when we took IDR device register in use. Our clinic manager said that it's nice to have good service reminders.
Yeah, that's right. And one thing actually that we don't have listed here is that we also have the capability of integrating the various maintenance providers and partners into this system, so that actually the maintenance provider can update the device information kind of on your behalf. So when they come and do the maintenances, that can be kind of streamlined as well. So you don't need to manually input all the data, but you can kind of outsource that work to maintenance providers. Okay, good stuff here. I think we are at appropriate timing, so we can still cover the best practices and tips without any rush. So this is related to the implementation process. And you made good observations around this, so maybe you can go through these as well on your lead.
Okay, one thing that based on our experience that I strongly recommend is doing the background work quite well before implementing IDEA. If you do background work well, the labeling process is then quite easily done. And with background work, I mean having kind of a agreed device general names within company, so that not everyone labels the certain device by their own nickname, but we have certain names for the whole company for certain medical devices. That is one thing. It helps then the inventory. It's probably good to do some kind of a guide for that, for the company policy for the inventory, and then also having good device Excels before importing them to IDEA. It takes less time than to label or tag the devices if you have kind of relevant information already available in IDEA when you do the inventory.
Yeah, that's correct. We've implemented a lot of large organizations, and this is kind of the very key part of every implementation. So before we do anything, we need to check the data formats and make sure that those are as unified as possible, because it saves a lot of time, like you said here. And the way that you guys did it, because you had pretty good Excel, so we uploaded those in. You had the device data already existing, and then each person logged in and used the NFC tags that we shipped them to run inventory of the devices. So they kind of linked the IDR smart tag to the device with their own phones. And this is where you have this this timing metric here. So it took around 30 minutes for each optical store with 15 to 25 devices to take inventory, because you had already created the items, so they just linked the tags and did inventory of what they actually have in each store. So you got all the medical devices accounted for, and everything that weren't able to find, those could be deleted.
Yeah, and if someone was missing, they added those. One thing I would like to point is that in optical side of our company, or optical chain side, the labeling was done by store managers, and they didn't have much experience about medical device register beforehand. They just had some maybe we had like 30 minutes Teams meeting beforehand just to guide them how to do it, and we had a couple of videos for a couple of minutes how to do the labeling. But after that, I think I got almost no one contacting me saying that I need help. So it was quite straightforward and easy, even for new users, to do the labeling. And also we made a couple of videos about that, how to add missing devices or add missing information. So that was only thing that kind of was a little bit extra if there was some missing information or missing device.
Yeah, that's definitely a good tip to kind of produce some relevant video content for implementation, because it makes things much easier. And or instructions at least, so that it's very as straightforward as possible for the people doing the actual work there.
In Silmäsairaala eye clinics, we had a little bit more devices, and they vary a little bit more than in optical stores, but still, I think the labeling time was quite not very long. So in 4 hours, 2 or 3 persons were able to do the whole or finish the whole clinic.
Yep. Yeah, that's good. Yeah, of course, when you have a team, it's at least much more enjoyable to do it.
Yeah.
But yeah, a pretty fast operation, and this is a good point. I think the piloting that we discussed, that it's good to kind of test with couple locations, see how everything work, and then kind of adjust if need be, and then do the full rollout. So
yeah, that's what we did, and actually with piloting store, we made those instructional videos then also for the later use for this rollout phase.
Yeah, and then you also had this very good point for large companies that have different business units, because now we've talked about Silmäasema, but you have I guess you have 3 more business units at least that are run by different people. So it's very important to have like representative of each business unit in the implementation project to make sure that it is kind of moving along smoothly at all fronts.
Yeah, I definitely agree with that. And we have, for example, we have a dental business unit. Just to say about one unit more than ophthalmic side. But anyway, the representative from dental unit took the same implementation process or made it possible there than we did within Silmäasema. We had these gatherings, or that regular gatherings with all the business units representatives during this implementation process, but then the work itself or the labeling or the inventory was done by different business units, and that I think that was good, because then they have kind of everyone knows their own devices best, and also take responsibility for their own devices. And essential part, not only the implementation process, but also keeping the device register up to date is really essential, and that this thing is related to that one aspect, because keeping the register up to date needs also someone to do the work, and if there is a representative in certain area, it's probably done easier.
Yeah, for sure. So engage as many possible as you can just gather from different business units, and get people using it on a day-to-day basis, so that they get accustomed to it. Yes. Okay, great. Do you have, Teppo, anything else that you want to highlight before?
Just to maybe wrap up that taking or implementation process is one part, but this is really linked to daily operations with medical devices. So it's good to, when you do the implementation process, it's already in that phase, it's already good to think also about how to make it work smoothly with the daily processes, with the medical devices, services, etc. So that the device registers is up to date even after 1 year or 2 years.
Yeah, and that's definitely something that software can help, because you can automate things, get reminders, people forget. So when you can build automation into the software, that's how you can ensure that it's keeping up to date as well.
Yeah, I agree, definitely. Even though I'm working with many softwares, I think still, even for me, it was very, very kind of for the first for the starting point, I felt that this Pro software is really easy to use, and that is also one thing we have had from our users. When say that it's easy to start to use the software.
Yeah, that's right. I mean, if the goal is to get more people involved in making sure that all the medical equipment is in proper shape, maintained properly, it allows more people to be pulled into the project and into using the software, and it's very easy, and it doesn't require any rocket science degree to start using it. So okay, this was the last slide of our content. Thank you very much, Teppo, for joining us and sharing your experiences with Excel and with our software as well, and kind of trying to highlight the differences and where organizations can improve in terms of managing their medical devices.
Yeah, thanks, Mikko, for inviting me to this webinar, and I was happy to be able to share a little bit my experiences.
Yes, and thank you for everyone who tuned in. If you have any questions, you can contact us, and we'll be sure to answer your questions. Have a great day, everybody.